A young movie star in 2020. More than 1.39 lakh Indians in 2019. 10,281 farmers and farm laborers. All deaths by suicide. Why does India have one of the highest rates of suicide in the world? Is depression leading to death? Is mental health the silent killer?
Hello and welcome. You're watching News Unlocked, the show that takes you behind the headlines. And today on World Suicide Prevention Day, we're looking at a critical issue that confronts us all in a way. Remember, it's not just Sushant Singh Rajput, but WHO data says that the world loses about 8 lakh people to suicide every year, which is roughly 2,200 lives each day. And India accounts for 17.8% of cases. On a day that is observed as World Suicide Prevention Day, we're going to look at that critical issue. And at a time when in India, 2019 and 2020 have seen a spike of about 3.4% in suicide rates. The connection that exists between mental health, depression and suicide. In fact, over the past 5 months, with the coronavirus pandemic raging across the country, the situation seems to have only worsened. From farm suicides to daily laborers to indeed celebrities, no one is immune to depression and possible suicide. That's our focus in this News Unlocked special.
A family of 4 in the coastal city of Visakhapatnam died by suicide on Wednesday night. Sources point towards financial distress as the possible reason. 19-year-old Vignesh died by suicide days before appearing for his NEET exams. Failing to get a job, a 28-year-old BTech graduate, Aman Sachan, died by suicide. Aman came to Noida on August 6th in search of a job and was staying with his elder brother. His body was found hanging by his sister-in-law. This came just a day after reports of a man dying by suicide in Lucknow. Here too, the reason was his inability to secure a job. On August 14, the decomposing body of a 40-year-old doctor working at AIIMS was recovered from his residence in South Delhi, the third such case in a month's time. Latest data released by the National Crime Records Bureau has revealed that more than 1.39 lakh Indians died by suicide in the year 2019. That puts the average deaths by suicide every day in India at 381. 67% of them were young adults. The total number of suicides in India saw a 3.4% rise in 2019 compared to 2018. Maharashtra, with 18,916 suicide deaths, is the highest in India, accounting for 1 in 7 cases overall. Among all the union territories, Delhi reported the highest number of suicides. And with no immediate end to the pandemic in sight, and with uncertainty fueling depression, medical professionals are concerned that 2020 might see a further spike in suicide rates, and the most vulnerable could be young adults and the elderly.
And tonight, therefore, we are going to delve deep into this critical issue. Why are so many people dying by suicide? I'm joined by 3 of the country's top mental health experts. Dr. Vikram Patel, Professor, Department of Global Health and Population at the Harvard T.H. Chan School of Public Health. I'm joined by Dr. Nimesh Desai, Director, Institute of Human Behavior and Allied Sciences. Ratnabodi Ray, mental health activist, also joins me from Kolkata. Thank you all very much for joining me on the show today. And I want to come to each of you with that question. When I look at the statistics, they're very worrying for India, and just the numbers. India accounting for 17.8% of reported cases, an average of 381 suicides daily for the year 2019. Is it that we don't talk enough about this, Dr. Vikram Patel? We need to talk much more about mental illness and depression that could lead to death by suicide.
Yeah, we certainly don't talk enough about it, but we do more talk than we do any action about it. I think the problem for me is the action rather than the talk. If anything, actually, Rajdeep, we are in a very unique moment in our history, because if you consider, mental health is the only health condition that is entitled, there is an entitlement for the people of India to receive care by a legal instrument, the Mental Health Care Act. This does not exist if you've got diabetes, for example. So the fact is we have political will. We've got tremendous conversation happening, not always in the right tone, as we've seen with the suicide of Sushant Singh Rajput. But nevertheless, there is a huge amount of conversation about mental health. But sadly, there's very little real action on the ground.
Now, what do you mean by action, Dr. Patel? What do you mean when you say there needs to be action on the ground?
Well, you ask anyone in a village in India, in an urban slum, or indeed anywhere where there is a generally low-income population, if you had a mental health problem, where would you go to get care? Think about what the response will be. The most likely response will be that I have no idea where I can go, and the only place I can go is to a mental hospital, which is associated historically with all kinds of fear, shame, and some amount of stigma. There is no real community-based care, Rajdeep, in the way that there should be in any part of the country. There is a good amount of policy work in this. For example, the idea that the health and wellness centers will become upgraded to provide mental health care. But actually, on the ground right now, this is only on paper. There's nothing in reality.
You know, one of the points that Dr. Patel just raised, Ratnaboli Ray, I want to take to you. Total suicides 2019, 42,480 in India. Farmers, 10,281. Daily wages, 32,559. Now, while an actor's alleged suicide is consuming us so much, farmer suicides, daily wage laborers, and in the coronavirus pandemic with job losses, we don't seem to focus enough attention on this critical. They seem to be faceless Indians. Is that a worry that there hasn't been enough work done there to somehow or reach out to the farmers and daily wage laborers?
Yeah, Rajdeep, as long as we propagate this monolithic idea that depression is a reason for dying by suicide, we will continue to not look at the social inequalities and structural barriers where we see a large demographic dividend that we continuously talk about dying by suicide. And this whole idea that depression causes mental illness and that we should get, while it is important that we should get care and treatment in the community setting, but it's also important to look at death by suicides in an intersectional fashion, looking at the poverty, looking at loneliness, looking at, the idea that I am feeling burdensome, and the entire othering of people by the state. Because if you do not fall into the grand narrative, if you do not conform to the grand narrative of who you are, then of course it results into alienation, it results into loneliness, and then you actually inculcate this entire idea of self-harm, which then translates into death by suicide. I agree with Vikram when he talks about community care, but I also think it's very, very important that we look at the intersectionalities and look at employment and look at farmers' death. And this whole narrative of tying up depression with suicide is, I think, faulty.
Okay, you're saying don't tie up depression with suicide. But the fact is that according to the figures last year, Dr. Desai, 34% of Indians who died by suicide died because of family problems. Family problems were seen as the #1 cause. Now, we thought India was a country with strong family bonds. Now, either those family bonds are cracking or there are new issues that are emerging, whether it's loneliness, whether it is, the nature of urban life, job insecurities. How do you see it? Is something changing that makes so many people feel it's necessary to take this ultimate step?
Yes, go ahead, doctor.
Go ahead, Dr. Desai.
The saga of the great Indian family, the South Asian family, is rapidly changing. And we first need to recognize that. India and South Asia has societies which are in rapid transition, very rapid flux. But at the same time, while agreeing with Vikram about not much action happening at the ground level for those who need, one must also recognize that health systems and mental health systems of this country and many countries like this are also in rapid transition. So there is these two transitional things happening. This society is changing very rapidly, leading to higher rates of depression, higher neglect, higher rates of suicide and other problems. We are also developing as a country mental health and health systems. Let's be sure that in the best parts of the world, the treatment gap for mental health is between 50 to 70%. In India, unfortunately, it's nearly 80%. So there's a lot of people out there in the society, in the community, who require and can be helped for depression, for other mental health problems, who are not reaching mental health.
Are you telling me that, just a minute, Dr.
Surely,
Desai? Dr.
there is
Desai,
much
are
more
you
that
telling
needs to
me
be done about
Dr.
making
Desai,
people aware of how to reach mental health services, and a very good collaboration between the government mental health systems, the NGOs and the society. But I think we are getting there.
But you're still saying 80% of mental health patients in this country may not be receiving the help they need.
Sure.
Dr. Patel, the question is, you've today in an article spoken about the need for empathy, the need to sort of, create a more empathetic India. Explain this to us. What do you mean when you say, talk of a more caring, empathetic society?
Well, I think first and foremost, we need a society in which the government brings the people together. It creates conditions of social harmony. It creates conditions in which the weakest and the most vulnerable, there are social safety nets for them. And, I think, Ratna Boli, I totally agree with what Ratna said earlier. Many, if not most, suicides occur in the context of intolerable social adversities. That said, a significant proportion of those people will also have depression, and we must not see this as an either-or in my mind. I think we should see this as both actions are needed. At the level of the state, the creation of a really accessible universal healthcare system in which mental health is truly and fully integrated, and also a social welfare system in which people who are actually very vulnerable, who are actually extremely sensitive to mental health problems because of their social disadvantage, are being cared for. I want to say one more thing, and I agree with Nimish, there is a lot of progress being made, but I do think one of the big challenges, Rajdeep, right now is that when we talk of mental health care, we are really talking about a very narrow biomedical model of mental health care. Not maybe the panelists here, but I think more generally in the country. The first thing that comes to your mind when you talk of mental health care is what I call the 3Ds. Doctors, diagnoses, and drugs. That is not mental health care for me. For me, mental health care involves embracing the diversity of mental health experiences, the local metaphors, the idioms, as well as a diversity of community-based strategies that includes very explicitly social support interventions. That, for me, is the full range of mental health care, not just pills.
For a moment, if I may just look at the case that has brought the focus in a way on mental health issues, which is the Sushant Singh Rajput case, Dr. Desai. Here is an actor who apparently went to 4 or 5 clinical psychiatrists, they were giving him treatment, and yet beyond the point there seemed to be a reluctance to publicly acknowledge it while he was alive. It almost seems that there is still a stigma associated with accepting that maybe you are grappling with mental health conditions. Now, if that happens to a celebrity actor, how does someone else tell the world that, look, I am grappling with depression, I'm grappling with mental health? Is there still a stigma, you think, associated with it, Dr. Desai? Has this been a failure in a way, a failure to destigmatize it?
Sure. But again, let's face the fact that stigma for mental health problems or all such issues of brain and mind is a worldwide phenomenon. Societies in transition have that stigma much more. Let's also face it, that if we can help overcome this stigma, if we can recognize that suicide is a psychiatric, medical, humane emergency. Depression is one of the commonest causes for suicide, not the only one. So we'll have to recognize that while going for treatment is important, continuing treatment, continuing to be in care is as important as getting into treatment. And so there is need for working on stigma, not just to get into treatment, to be able to talk about it like we are doing now, and in individual instances, continuing treatment, and as Vikram said, socially, culturally based rehab centers and rehab mechanisms.
Interesting that you need to build in a way those community centers. One of those interesting facts, again, statistics that we have, Ratnaboli, is soaring teen suicide. 2016, 9,478. It's now gone up to more than 10,000 and increased by 3.4%. The young seem particularly vulnerable, especially in the uncertain times that we live. Should there be a special focus on that?
Yeah, Rajdeep, absolutely. And that goes to prove my point that this is not a public health, this is not a mental health issue just. It's a public health challenge, and we have to strategize it accordingly. And I was also mentioning about the demographic dividend that we talk about, that large number of young people are now dying by suicide. But the point that I also wanted to bring in another piece of data is that we have seen that only 50% of people with mental illness die by suicide, and rest 50% is because of many, many other reasons. And if we look at teen suicide, which spikes up after examination result, is also how we look at the larger issues of education, larger issues of employment, larger issue of debt, larger issue of our policies regarding the farmers. And therefore, it has to be a multi-pronged approach, multi-pronged strategy to deal with death by suicide.
Because
every time we associate suicide as a mental health issue we will not be able to create an environment, create a culture of help-seeking behavior. The question that you asked, Nimesh, also has to do with the fact that we feel that death by suicide is because of a character flaw, because of certain weakness, which then creates and the whole discourse gets shrouded in silence, and we do not seek help. The moot point that I'm making is that we have to create a culture of help-seeking behavior, and that we should not think mental health or mental health issues as a matter of shame, as a matter of character weakness, as a matter of flaw.
Right. Vikram Patel, Dr. Patel, I want to understand, therefore, the role. Is the real challenge to create those strong community care centers, or is the challenge to recognize the intersections between possible mental health problems, the nature of the economy, the nature of certain industries that we work in? This is calling for a sort of very, very multi-pronged approach, which is not easy possibly in a country like India, where in any case, people who live in, say, very at the bottom of the pyramid or live on the margins of society, perhaps don't even have the luxury of dealing with these issues easily. Their families are unable to deal with it.
Yeah, no, absolutely. And, to be honest, Rajdeep, this has been one of the greatest stumbling blocks in addressing mental health in India, is the massive amount of disadvantage and poverty in the country that makes the misery of living in that condition in India indistinguishable from mental health problems. This is why Sushant Singh Rajput's suicide attracts so much attention in my mind. It's because he's a wealthy, a glamorous man, and there is no other external apparent reason as to why he should be depressed and attempt to end his life other than the fact that he's sick. But if you're very poor, you're a migrant laborer trudging home from Delhi for hundreds of kilometers with a child on your back, there is such a lot of misery just visible in your condition that the question of whether you have a mental health problem seems almost an abstraction. So I do think that the poor in our country have a double whammy. Not only do they have to face poverty, but they're also denied the right to have a mental health problem because their mental health problem is seen as simply the misery of their poverty. And one has to find the right balance in this conversation. You asked me earlier about community centers. I actually think the government's health and wellness centers actually offers a very unique platform. And I really, really pray and wish that the health and wellness center, at least the way it's described on paper, with a community health officer who will be trained to provide low-intensity psychosocial interventions, hopefully will also extend that to connecting the health and wellness center with social welfare services in that particular region. I hope it's realized. And we as a country must work together to make sure that those health and wellness centers become a reality.
You know, the fact is, though, we are a country with over 720 districts, Dr. Desai, and this will have to reach, in a way, those districts that are far-flung from our major metros. You know, the issues of depression, of mental health are not confined to urban India. They cut across this country. Many districts do not have those wellness centers. Is that a problem? That we, in a country of our size, to decentralize the entire approach and reach out to every district?
I'm glad you brought that out, Rajdeep, because from all three of us are saying in this chat with you, I must bring a bit of pragmatism. While mental health issues and depression and suicide and many other mental health issues are at one level socio-political, economic, that's a journey that human race in different nations keeps going through, and we hope that will happen. But right now, for the next few years and decades, what we need to do, as my friends are saying, is that interface between the public health system, the mental health systems, and the NGOs and the society. Right now, in these few years and next decade, we need to get services for those who need services and get rehab services for them, community-based. So the two things will have to go together. The transition from all the poverty and all the deprivation that large part of the population has to a better sense of state of living is one journey. But there is a need for a strong pragmatism in building mental health and public health systems which addresses mental health issues within a public health society-based media.
Right. You know that
Rajdeep,
very quickly, yes.
Rajdeep, very quickly, do you know that India doesn't have a suicide prevention policy as of now? The statistics that you started with needs immediately a suicide prevention policy, and do we have that? And how can we not look at state as one of the most important stakeholder and also is a facilitator of the othering which leads to death by suicide?
I take your point. The very fact that we've actually been able to keep this issue on prime time alive, in a sense, is perhaps a recognition that we need to start building these conversations in the society around us. I know you're saying that the conversations have begun, but we need to do more of these conversations and perhaps find our way to discover those intersections in society that would spread empathy in these difficult times in which we live. Dr. Patel, Ratnabori Roy, and Nimish Desai. Dr. Desai, thank you so much for joining me here. I want to turn, therefore, we started telling you about statistics. Remember, India's COVID caseload is now the second highest in the world. Many states are struggling to restart their economy, forcing millions of households, especially farmers and daily wage laborers, into poverty. Many experts believe all of this is contributing in a way to that other long-running tragedy, farmer suicides. Take a look.
2019 saw 10,281 farmers and farm laborers die by suicide. Many experts believe India's farmer suicide numbers are massively underreported, and that the exact reasons leading to these deaths often remain undocumented. But the cycle usually remains the same. In the first week of September, left reeling due to another bout of failed crop and an increased debt, Balveer Lodhi, a farmer in Madhya Pradesh's Vidisha district, hung himself.
तो बोले जा रहे थे कि अब क्या होगा सो भी नहीं आ रहा, अपन कर्जा वालों कर्जा कैसे देंगे, कर्जा बढ़ता जा रहा है, इतने यही बोलते जा रहे थे। तो मैंने उनको बोला भी कोई दिक्कत नहीं है, इस साल नहीं अगले साल पड़ जाएगा। पर बोले कैसे पड़ेगा, 3 साल से फसल पिटती हुई आ रही है और सरकार से कोई फायदा भी नहीं मिल पा रहा है।
But Lodhi's death might not even end up in 2020's farmer suicide statistics, because the local administration claim Lodhi did not own the land he tilled. Rather, he was a farm laborer. While the family disputes this claim, the fact remains that many authorities have different criteria to categorize a death by suicide. The 2019 data from Madhya Pradesh itself shows that majority of farm sector suicides were of farm labor and not of cultivators. The National Crime Records Bureau data shows suicides in the farm sector have declined over the last 4 years. But then the NCRB has done away with recording causes of farmer suicides. 3,33,407 farmers have died by suicide since 1995, from the time NCRB started publishing farmer suicide data.
That's it on this India Today special. Stay well, stay healthy. Thanks for watching.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.